I'm Charles Bankhead of MedPage Today. A study reported in the Journal of Sexual Medicine showed that obese men with type 2 diabetes had significant improvement in sexual function following weight loss. I'm speaking with Dr. Cully Carson of the University of North Carolina in Chapel Hill, a urologist who has studied sexual function for a number of years. Thank you for joining us today, Dr. Carson.
Thank you.
What is new about this study? Because as the authors acknowledge, obesity has been known to affect sexual function for some time.
Yes, there are a number of studies that have shown that type 2 diabetes, obesity, really anything that affects the vascular system will cause erectile dysfunction and sexual dysfunction. This study has several new components to it. Number one is that they looked at sexual desire, which really hasn't been looked at before. The second thing is they look at the effect of two different types of diets on sexual function using standardized instruments or questionnaire, which hasn't been done before. There's one previous study from 2004 that looked at diet, weight loss, and erectile dysfunction, the regaining of erectile function, I should say, which showed a definite correlation. But this study went further by looking at two different kinds of diets, number one. Also looking at the sexual desire part, number two. They also looked at hormone profiles, number three, which was important. And they also looked at markers of vascular health. So they looked at flow-mediated, or endothelial cell flow-mediated changes. They looked at some inflammatory markers such as C-reactive protein and IL-6. So those are all new things. And it was the interesting part of this study to me was that not only did they show that the patients had an improvement in erectile function, and that improvement happened as early as 8 weeks after dietary treatment, which is amazing, but it continued out to 52 weeks. So even at 52 weeks, it continued to get better. The erectile function was getting better. Also, sexual desire was getting better. So both of those markers were improving, and at the same time, people were having some improvement in the inflammatory markers, which are vascular, objective vascular measures of vascular health. The other part that was new is that they also looked at lower urinary tract symptoms, the symptoms of urination that we also know go along with obesity, that go along with sexual dysfunction, and we know that those things are independent markers for erectile dysfunction. They also showed a highly statistically as well as clinically significant improvement in lower urinary tract symptoms in those men that had significant lower urinary tract symptoms just with dietary intervention. And so it was a very interesting study from that standpoint. So all of these health markers improved along with erectile function.
Is there a magic number that men should aim for in terms of weight loss?
Yeah, both this study as well as the Esposito study in 2004 looked at 10% of body mass weight loss. And that seemed to be the magic number in both of those studies. So I think 10% of weight, especially in patients that have significant obesity, patients with type 2 diabetes, is probably a good target. And it's a conservative target as well. It's not a dramatic weight loss. And even 10% for somebody who has a body mass index well over 30 can have significant lifestyle and quality of life improvements.
This study, as you pointed out, looked at a number of laboratory outcomes. So what is your take in terms of what is the origin of the improvement? Is it physiologic? Is it psychological? A combination? What do you think?
I clearly think it's a combination, but we used to think it was mostly psychological. The patients looked in the mirror and said, gee, I look better. Gosh, I feel better. But in fact, there's good physiologic reason for improvement as well. When they looked at the endothelial controlled changes in the function of the vascular tree of the blood vessels, they found measurable changes, measurable improvements in those outcomes in endothelial cell function. So endothelial cell function is important for blood pressure, it's important for cardiac function, but it's very, very important for erectile function. So that by itself would answer the question as to why this is happening.
Okay, well, again, thank you very much for taking the time to speak with us this morning. You've been very helpful.
It's absolutely my pleasure. And this is a great study, and I think it really has an excellent message for physicians in counseling patients to lose weight, but also for our patients that just a little bit of diet with either low calorie or high protein diet can make a huge difference in their lifestyles.
Okay. From MedPage Today, I'm Charles Bankhead.